Hello, it's Alistair Gray, Clinical Services Lead Pharmacist at East Lancashire Hospitals, giving you an overview of the community pharmacy side of Refer to Pharmacy. Now, if you've received a notification from the hospital, either by fax, text or email, you will know you've got to log in with your secure details to access the system. When you log in, you immediately are taken to your pending referrals folder. There are three other folders: the active folder, which shows people who you are currently doing work with. There's a completed referrals, which is your archive. You can still view the referral and the discharge letter, but it's no longer active. And finally, rejected referrals. These are referrals where you should not have received them and you've sent the information back to the hospital. You can't actually view the patient's discharge letter, you can just see who it was you rejected. So let's have a look at the pending referrals folder. You'll see some pink and some blue banded referrals. The blue banded referrals are hospital admission notifications that you have acknowledged. So you know your patients are in hospital and you put a note to yourself to say, look, stop dispensing until you get a discharge notification. This pink one here shows you've not acknowledged it yet, so you can view that. You can see who's been referred, and you can either acknowledge or reject that notification. You can also leave little notes there which can be seen at the hospital end. If you reject the notification, it's required that you actually say why you are rejecting it, so it's understood at the hospital end. They can then either refer on or abort the referral. If you acknowledge the referral, it turns blue, so you've taken the right action, but make sure you've put a note on your PMR or wherever else you record that information. This patient here has not been acknowledged and they've been discharged. So let's have a look at that one. Again, you can accept or reject the referral. If you reject, it actually does give you a drop-down series of reasons for rejecting the referral. Let's cancel that though and go back to pending. If we acknowledge it, accept it, it takes you into the active folder and you now see that there's a bit more information available. By clicking on view, you can click to view the discharge letter, which opens up a separate tab. It shows the entire letter that the GP gets at the same time. So you get diagnosis, procedural and follow-up information, which helps inform your conversations with the patient. You can see what's been started, stopped and changed and why. You can view the patient's allergy status. And finally, there's the table of the patient's current drug history. If it's an information referral that you've received it for, then make a note on your PMR to check this particular letter next time an FP10 turns up to make sure the information matches. If it doesn't match, you'll need to discuss that with the GP because it could be an unintentional error. The consultation referrals, you've already got the contact information for the patient to arrange a consultation, and then you can prepare for that consultation with the information contained in the letter. Once you've done whatever you're going to do, there is a process outcome which allows you to close the episode down. So you can either complete the MUR, either from the pharmacy or if you've done a home visit. Similarly with the new medicine service, whether you updated the PMR or the PMR there was no changes. Now it might be you've had a hospital admission notification and nothing actually changed with the patient's medicine, so that's a sort of scenario where you would use that one. If you could not complete the MUR or new medicine service, then you're asked to collect the reason why. If it's not covered there, click other and you'll get a drop down to allow you to do that. You can leave little notes as well, which might be useful to you. We asked to know whether there was any unintentional prescribing errors made by the GP, because this really will help to show the value of the system to everybody involved. There are 4 options. Yes, there was an unintentional discrepancy. The information was correct. The GP intentionally changed his mind or her mind about the prescription from the hospital, or there were no changes involved in this one. Whichever one you select, it's optional whether you put any extra information on there. Obviously, if there was an unintentional error, we would really like to know that, because that's a lovely vignette for showing the value of the system. Finally, we just want to know whether it saved you time or reduced any medicines waste, or conversely it's cost you time or caused medicines waste. If it's neutral, just tick the middle one. If it saved you time, just type in how many minutes it saved you if you haven't had to dispense a bunch of monthlies, and how many items were not dispensed, because that is a useful kind of way of putting value on the system. And when you times that up by the number of referrals across the entire health economy, that will add up to a fair sizable amount. Finally, click Update the referral, and that will archive the information into your completed referrals. Thank you very much for watching.